Now back here on the local front, despite the slight decline in the daily tally, authorities remain on high alert over the spread of the so-called STEALTH OMICRON here on the local front. For more, I have BO-KYOUNG in the studio with me. BO-KYOUNG, welcome back.
Thank you for having me, Sunny.
So let's begin with the presence of the STEALTH OMICRON here on the local front.
Well, health authorities say they are keeping a close eye on BA.2 subvariant of Omicron, or STEALTH Omicron as it is being called. Researchers say this variant is believed to be more contagious than the original Omicron strain, and BA.2 infections are rising both domestically and abroad. In Korea, among locally transmitted cases, the detection rate for the BA.2 version Omicron rose to more than 10% in the fourth week of February, compared to just 1% in the first week of that month. When it comes to imported cases, the share of BA.2 infections has risen to more than 18% from 10%. When looking abroad, STEALTH Omicron has already become the dominant strain in countries like Denmark, China, and India. Health authorities say they will keep a close eye on the BA.2 subvariant and to potential impact on the timeline and the speed of our Omicron peak. However, given that the number of confirmed cases is declining in countries where BA.2 transmission rates are high, there are some room for early optimism.
Right. BO-KYOUNG, yesterday, that would be Wednesday, was the first day of the new school year for students here. Tell us a bit about the Education Ministry's latest guidelines to ensure safety within the academic arena.
Well, Sunny, the ministry is recommending that students use self-diagnosis mobile app to report their health conditions with health authorities. And more than 83% of students in kindergarten, elementary, middle, and high school took part in self-screening. Among them, less than 2.7% were advised not to go to school. The ministry is also operating makeshift PCR screening centers for students and staff and providing rapid antigen test kits for self-testing purposes.
As planned, we have secured 6,060,000 rapid antigen testing kits for the first week of March and provided one for each student. The second week's supply of 13 million will be given to students and faculty members by March 4th.
Right, and speaking about rapid antigen tests kits here in the country, BO-KYOUNG, there are concerns that they're not as reliable nor as accurate as a PCR test, especially when used by a person who is not a trained medical professional, right?
That's right, Sunny. There are many people who got negative self-test results only to test positive later at a doctor's clinic using the same rapid antigen test. The Korean Society for Laboratory Medicine says rapid antigen testing only has a detection rate of only 20% when self-administered and 50% if done by medical staff. Experts say detecting the virus at an early stage of infection requires samples from deep inside the nose, more than 10 centimeters in, but self-test kits can only collect samples from near the nostril. Besides, it is difficult for people who have no anatomical knowledge to administer the test properly.
Only those who have a severe runny nose after getting the virus test positive, so it's hard to say if the test kit is very efficient.
Positive results come out only 3 to 4 days before and after the symptoms show as time passes by and viral loads increase. It is clear that a person is contagious during that space of time. It is also difficult to collect samples all by themselves.
Therefore, medical experts recommend those with symptoms to visit a doctor to get their rapid antigen tests.
Right, I see. In the meantime, BO-KYOUNG, I understand the government here remains determined to ease social restrictions as we enter a new phase in this pandemic.
That's right, Sunny. Currently, our social gathering cap of maximum 6 people and 10 p.m. shutdown orders are due to expire on March 13th. However, the government may not even wait until then to ease its current guidelines, as its priority has shifted towards minimizing the number of seriously ill patients and deaths. The government could make an announcement as early as this Friday after consulting with medical experts, business owners, and local governments. And its options may include raising the social gathering cap to 8 people and extending business hours to 11 p.m.
Right, and you'll probably keep us updated on that. BO-KYOUNG, thank you for that coverage.
Thank you.